Je reconnais la députée de Miramichi-Est.
Thank you, Madam Speaker. It's a fine day to be in the legislature of New Brunswick today. Let's see if we can keep it going. I move, seconded by the Fredericton member from Fredericton-Grand Lake, whereas 2 out of every 3 patients experiencing acute heart attack meet eligibility for pre-hospital thrombolytics, whereas nearly 2,500 New Brunswick residents will be hospitalized each year following a heart attack, whereas thrombolytics administered within 1 hour of symptom onset can abort up to 30% of heart attacks, whereas New Brunswick paramedics are among the highest educated in the country, whereas paramedics in New Brunswick already have the foundational education to give thrombolytics, and the regulator authorizes paramedics to use them, but the government of New Brunswick does not, whereas paramedics in British Columbia, Saskatchewan, Manitoba, Ontario, Nova Scotia, and Prince Edward Island all administer pre-hospital thrombolytics. Be it therefore resolved that the Legislative Assembly of New Brunswick urge the government to make the necessary policy changes to allow advanced care paramedics to administer thrombolytics. Thank you, Madam Speaker.
Madame la députée de Miramichi-Est, appuyée du député de Fredericton-Grand Lake, ont proposé ce qui suit. Attendu que 2 patients sur 3 qui subissent une crise cardiaque aiguë répondent aux critères relatifs à l'administration avant l'arrivée à l'hôpital de médicaments thrombolytiques. Attendu que près de 2500 personnes du Nouveau-Brunswick sont hospitalisées chaque année à la suite d'une crise cardiaque. Attendu que l'administration de médicaments thrombolytiques dans l'heure qui suit l'apparition des symptômes peut interrompre jusqu'à 30% des crises cardiaques. Attendu que les travailleurs paramédicaux du Nouveau-Brunswick sont parmi ceux qui ont reçu la formation la plus approfondie du pays. Attendu que les travailleurs paramédicaux du Nouveau-Brunswick possèdent déjà la formation de base leur permettant d'administrer des médicaments thrombolytiques et que l'organisme de réglementation autorise les travailleurs paramédicaux à en faire l'utilisation, mais que le gouvernement du Nouveau-Brunswick ne les y autorise pas. Attendu que les travailleurs paramédicaux en Colombie-Britannique, en Saskatchewan, au Manitoba, en Ontario, en Nouvelle-Écosse et à l'île du Prince-Édouard administrent avant l'arrivée à l'hôpital des médicaments thrombolytiques. Qu'il soit à ces causes résolues que l'Assemblée législative du Nouveau-Brunswick exhorte le gouvernement à apporter aux politiques les changements nécessaires pour autoriser les travailleurs paramédicaux en soins avancés à administrer des médicaments thrombolytiques. I recognize the member for Miramichi East.
Thank you, Madam Speaker. I'm very proud to rise today as a member of the Legislative Assembly, but also as someone who spent 2 decades working in the healthcare department and in healthcare. 8 of those years I work in the emergency department, where I have seen firsthand the difference between life and death. I've seen the difference between full recovery and permanent damage, and between a routine discharge and a funeral. And today I want to talk about something simple. It's not complex. It's but a new initiative. It's not a new building or a massive investment. It's just a small, evidence-based policy that changes the lives of many. Today, I ask the Legislative Assembly to urge the government to take a practical, evidence-based step forward to make the necessary changes to allow advanced care paramedics to administer thrombolytics in pre-hospital settings, on the scene, in an ambulance, in your living room, where time is muscle and every second counts. So I'm going to start off with a little bit of stark facts in New Brunswick. We know that 2 out of every 3 patients who are having a heart attack are eligible for pre-hospital thrombolytics. That's not a guess. That's what the evidence tells us. These patients whose lives and outcomes could be dramatically improved by just this one intervention. We also know that nearly 2,500 New Brunswickers are hospitalized each year because of a heart attack. That's nearly 7 people every single day in our province alone. Some of them will walk out of the hospital and some of them won't. But here's the most important piece of data that I can give you. If thrombolytics are given within 1 hour of symptom onset, they can abort the heart attack in up to 30% of the cases. That's not reduce and it's not slowing down, that's completely aborting them. So in plain language, that means the clot that's blocking the blood flow to the heart gets broken up fast enough that damage to the heart muscle is either prevented or drastically minimized. I would like to talk a little bit about our paramedics because I truly have a soft spot for our medics and all first responders. The Brunswick paramedics are among the highest educated in our country, and I don't say that lightly. I've worked alongside them. I've seen the managed cardiac arrest. I've seen them manage trauma scenes, overdoses, complex respiratory failures, all before the patient even reaches the hospital. I've seen the difference that their work makes, and I've also seen the limits of what they currently are allowed to do, and even when they're fully capable and trained to do more. It's not only the technical skills that impresses me about our paramedics, it's the compassion, it's the kindness and the patience that they show their patients every single day. We often said it in this house, our worst day is their every day. And they enter each call with professionalism and empathy and strength. And I say strength because no matter what their last call was, they enter their next call with the same integrity and the same professionalism as the last one, with no time to debrief in between. These healthcare professionals are trained to handle any case on their own and with split-second decisions. And with these most highly trained advanced care paramedics in New Brunswick, and they already have the foundational training and to administer thrombolytics, the regulator already authorizes it, the scope of the practice already allows for it, and yet we have not made the necessary policy changes to allow it to happen yet. And I'm not just saying this government, this is something that they've been requesting for years now. So we all are in fault of this, and we can change that today, because now is the time to make it happen. So what does this mean practically? It means a father gets to go home to his kids. It means a grandmother doesn't spend the rest of her life with heart failure. It means fewer ICU admissions, fewer surgical interventions, shorter hospital stays, and better outcomes right across the board. And we're not talking about theoretical scenarios. This isn't some rare condition. This is one of the leading causes of death in our province. Heart attacks are increasingly affecting younger adults. Since 2018, there's been a 2% annual increase in heart disease-related hospitalizations amongst adults under 40. And now, 1 in 5 heart attacks occur in individuals aged 40 or younger, and that's up from 1 in 10 just a decade ago. The risk is real and it's increasing, and we have the power today that we can do something about that. If we allowed thrombolytics in the field, that paramedic could give the clot-busting medication right there on the spot, 30 minutes even before they reach the hospital. That could be the difference between walking out with a stronger heart and spending the rest of your life with heart failure. It could be the difference between surviving or not surviving. I remember my mom when she had her heart attack just a few years ago. Arriving at the hospital, she came in with severe chest pains. Luckily, we don't live very far away. And she was given the thrombolytics in our trauma department. And just minutes after, she started feeling better, to the point where when they told her she was going to go to St. John to have an angiogram, she literally said, "I don't need it. I feel great." She thought she can get right up and go home. Well, she did need it. She ended up going for the angiogram in St. John, and then she ended up coding during the angiogram. And luckily, she's here today, and she did survive that, and she's here today with us, and I'm sure she's watching intently, so hi to my mom and dad. And all this to say that if she had not received those thrombolytics in the short time, that she could have coded earlier, and that with full blockage, her outcome could have been a lot more different. And our outcome as our family could have been a lot more different. We're not at reinventing the wheel, Madam Speaker. This doesn't need to be studied or have pilot projects or 6 months of committee sessions about. like we often see in the legislature. This is something that's not new in Canada. 6 provinces have already started to allow their paramedics to administer pre-hospital thrombolytics. British Columbia, Saskatchewan, Manitoba, Ontario, Nova Scotia, Prince Edward Island have all allowed their advanced care paramedics to give thrombolytics on the field. And in fact, PEI has been doing it since 2007. So that's nearly 2 decades of saving lives. And here we are in 2025 and still waiting. So what are we waiting for? What's stopping us? It's not the education. They already have it. It's not regulation. That box is checked too. And it's not precedent. We're not asking paramedics to perform heart surgeries in the back of an ambulance. We're asking them to give a time-sensitive, well-understood, evidence-based drug within their skill set in the line with national best practices. Why is it that a paramedic in Summerside can give a life-saving medication that a paramedic in St. Quentin, Chipman, Sussex, or even in Miramichi is not allowed to give? Even when the patient meets the exact same criteria, and even when the paramedic has the exact same training. I'll give you another scenario, one that I've seen far too many times. We have a young gentleman in his 50s in rural New Brunswick who wakes up with chest pains. His wife calls 911. The ambulance gets there within 15 minutes. The paramedics do an ECG and it shows a classic STEMI, a massive heart attack. And they're 90 minutes away from the hospital. Well, under the current rules in New Brunswick, those paramedics, as amazing as they are, can give oxygen, aspirin, nitroglycerin, morphine, but not the thrombolytics. So they load them up and they start to drive, often doing chest compressions, which also is very hard on the body and usually breaks ribs. They arrive at the hospital and likely to an ER that is backed up when they arrive. Maybe the cardiac team is still assembling. Most often, I know in our hospital, they call in en route a few minutes ahead of time, so mostly everybody's ready, thankfully, but there still could be delays. And that delay, that heart muscle dying minute by minute. As any emergency healthcare will tell you, time is muscle. The longer the heart goes without oxygen, the more the muscle it loses. And the more muscle it loses, the less likely the patient is to survive, recover, or return to a normal life. Maybe by the time thrombolytics are given, it's too late to avoid significant damage. Maybe that man survives, but ends up in heart failure for the rest of his life. Or maybe he doesn't make it at all. Now imagine the same situation in Nova Scotia or Ontario. That paramedic gives thrombolytics on site. Under protocol and physician guidance, the clot is broken up even before they hit the road. By the time they arrive at the hospital, the patient's pain is gone, their ECG is improving, and that's what we're talking about. That's the difference that this policy will make. Now I want to talk about risks for a second, because with all medications and all policies that we do in this House, there's always risks involved. Thrombolytics are a powerful drug. They do carry a risk of bleeding, especially if given to the wrong patient. But this is not a new drug, and this is not a high-risk intervention in trained hands. Paramedics, this in untrained hands. Paramedics are not improvising in the field, and they follow strict evidence-based protocols, screen for contraindications, and consult with emergency physicians when needed. They're structured, guided, and monitored decisions. The experience from 6 other provinces show that paramedics can and do administer thrombolytics safely and effectively, and in PEI, they've had no serious safety concerns whatsoever associated with the pre-hospital thrombolytics since adopting the policy nearly 2 decades ago. So are there risks? Yes. Are they greater than the risks of doing nothing? Absolutely not. Our ACPs already manage advanced airways, they deliver synchronized cardioversions, they treat arrhythmias, they administer powerful medications, and coordinate complex pre-hospital care. They have come a long way from being the ambulance drivers they were known years ago, because that's basically what they did. They picked up a patient and they drove them to the hospital. But their scope of practice has evolved immensely over the years, and now they are classified as healthcare professionals. Another proud moment we shared in this legislature just a few years ago. The idea that they're somehow not ready to handle the thrombolytics would be completely inaccurate. And Madam Speaker, it's quite frankly absurd. What they're lacking is not skill and it's not knowledge, it's just permission. And hopefully we can change that today. We trust these paramedics with the lives of our loved ones every day, as they trust us to make decisions for them to do their job to the full extent of their abilities every day. So let's trust them with the tools to do that. I'll also touch on the fiscal responsibility, because we all know that this government is all about fiscal responsibility, and I'm sure it's weighing on their minds, but this policy change is cost-effective. It actually doesn't cost a cent. We're not building new facilities, we're not hiring hundreds of new personnel, we're not adding layers of bureaucracy. We're simply enabling professionals to do what they do best and to do what they've already been trained to do. We're using existing healthcare workforce more effectively. And by doing so, we reduce ER strain, we reduce ICU load, and overall hospital resource usage. We just need to put the medications on the truck, and we can let them do the rest. In the long term, this move saves money while saving lives, and that's good health care policy. So what message do we want to send the people of this province if we fail to act? Are we saying that we know how to save more lives, but we're not ready to take the next steps to do so? Are we telling rural patients, sorry, but you live too far from help? Or are we saying we must trust our paramedics, we believe in our modern medicine, and we are willing to act in the best interest of New Brunswickers? I know which message I want to stand behind. So to my colleagues, I've stood beside paramedics as they fought to keep patients alive. I've seen their strength, their judgment, and their commitment. I've held the hands of patients waiting in hospital beds, knowing their earlier treatment could have made all the difference. And I've talked to families and told them that we did everything that we could, wondering if there was something more that we could have made a difference and had a different outcome. But we can't go back to fix those cases, but we can prevent the next one, and the next one after that, and the hundreds more that will follow unless we act. So today, I'm asking this House to support this motion, not because it's convenient, not because it's easy, but because it's the right thing to do, because it saves lives, because our paramedics are ready, they're trained, they're willing, and this is what they've been asking for. And the people of New Brunswick deserve the very best care that we can give them. Let's not be the province that lags behind while others lead. Let's be the one that listens to the data, respects the experts, and acts decisively. Let's pass this motion and give advanced care paramedics the policy support they need to deliver thrombolytics when and where it matters the most. Thank you, Madam Speaker.